Hi, everyone. Hi, everyone. Welcome back. I'm Dr. Samantha, the maternity mentor, here for another one of our live Q&A sessions that I have every Monday at 9 p.m. Eastern Standard Time. This is my chance to talk to you guys and answer any of your questions that you might have, as well as your chance to interact with me. We are on Facebook and Instagram for additional content. And please like and subscribe to the channel and share the channel with your friends and family. As being a part of YouTube, it's very important that we gain subscribers because that's what keeps us going with them. And that helps us to maintain what we're doing here and give the content that we are giving to you. I really appreciate all of you guys coming. One of the things I want you to do is if you guys have any questions, please feel free to put them into the chat and I'm going to make sure that I get to them, as well as answer some of the questions that you guys put in on the videos this week. So I really appreciate all of you guys joining me, and I'm going to go ahead and get started because we do have a comment in the chat already. So this is from the sales promoter. Hi, I feel as though I'm pregnant, but I'm afraid of letting my doctor know, as though feeling guilty of even trying again. My body feels fine, but any advice on how to overcome the guilt of wanting to try soon? So this is a great question to start, and I really appreciate you putting this into the chat. So I think that part of what this comment is reflecting is the idea of baby spacing and giving a chance for your body to heal before you go ahead and you try again. So there are a lot of guidelines that recommend that you wait, if you can, for up to 2 years before having another baby. And that's for a variety of reasons. However, there are people who don't wait. Sometimes you don't wait because it's an accidental pregnancy. Sometimes you don't wait because you want to have another baby and you feel like you're ready to go, which it sounds like you feel the same way the sales promoter. So when we put out these guidelines, it's a guideline and it's something that is important to kind of look at and look at the evidence behind them. At the same time, you are a human being who has the right to, you have the right to your own body. You have the right to make your own decisions. And if it is important to you and you feel ready to try again, then you can try again. She wrote, losing my baby was the worst feeling ever. Losing a baby is it's tragic. It's just, you can't describe it. Nobody can understand what that's like unless you've been there. And so a lot of people who've had a loss, they want to try again sooner. And that's understandable. It's very understandable that after such a loss, you want to try and have a baby again. The I don't like about this comment, and I feel really bad, is that you feel guilty to tell your doctor that you might be pregnant or that you want to try again. That doesn't sound like a good therapeutic relationship. Your doctor should be there to help you and guide you. Listen, in my line of work, there are times that I recommend stuff to people. In fact, every day, I think I said it to 3 people today. Patients come in, they're anxious and depressed because I do psychiatry now. And I'll look at them and I'll be like, listen, I think you should take this medication for your anxiety or depression. But the next thing I say to them is, if you don't take your medicine, if you come back to me and you haven't started it, I'm not canceling you. I'm not firing you, and I'm not sending you away as a patient. Why would I do that to somebody who's trying to get help? You have the right to make your own decisions over your body. Our job is to make sure we tell you risks and benefits, but then we need to support you with your choices. You need to feel comfortable to ask us the questions you need to ask, because if you're pregnant, your doctor needs to give you care, and you shouldn't feel like you can't say to them, hey, I'm pregnant. And that's really unfortunate. That's the sad part. Honestly, I don't think you should feel guilty. I just don't. If you want to try again for another baby, try again for another baby. If you think you're pregnant, congratulations. It is so hard after you've lost a baby. But honestly, if your doctor, if you feel like they would make you feel guilty, find another doctor. That is just not the type of medical care somebody should receive. They should instead receive, okay, let's do this. Let's get you a healthy pregnancy. And that's what it should be like. So I appreciate you sharing that. I hope that helped. But I mean, honestly, I know it may not take away your guilt tonight, but I wouldn't feel guilty at all. You have the right to do that. So I hope that helps. I'm going to go ahead and start answering some other questions that we got. Thank you for sharing the sales promoter. If you guys have any other questions, please feel free to put them in the chat. I'm going to go ahead, and I actually had a whole bunch of questions this week on my antibiotics video, which is a very, very common video for us to get questions on. So when you're pregnant, it is very, very stressful to take any medication. Medications, a lot of women are very concerned about what's going to happen to the baby. And so they are very hesitant to take anything. And the antibiotic video, one of the reasons why I put it out is antibiotics by far are the most common medications that are being prescribed. And that's because infection during a pregnancy puts you at high risk for miscarriage and preterm birth. So we want to treat any of the infections you have very aggressively, and most of the infections are bacterial. So because you have bacterial infection, we need to get that treated. So antibiotics are the way to go. Now, antibiotics do not treat viruses, they do not treat funguses, yeast, anything like that. Only bacteria. And if you've got a random cold, you don't want them giving you antibiotics unless they've proven that that's bacterial. But once we have a bacterial infection in place, we need to get it treated, because if left untreated for a pregnant woman who's immunocompromised, and all pregnant women are immunocompromised, you can actually get sepsis, which is a blood infection, which infects the organs. And because it's a blood infection, that infection can go across the placenta to the baby. So it's very important that you guys get it treated, because otherwise it could be a huge issue. So we see a wide variety of antibiotics being prescribed. If you're prescribed an antibiotic, if you start to take it, you need to take all of it. Do not stop when you feel better. And you will feel better after a couple of days. But the thing is, you need to take all of the antibiotics, or the bacteria that's left won't actually be dead. It won't be killed, and it will develop defenses, and then you'll have a treatment-resistant infection, which is even worse. And what people don't realize is once you have a treatment-resistant bacteria, where we might have in the beginning given you a medication, one of the medications that was asked about this week is it safe to take cefixime, 200 milligrams during pregnancy? So that's one antibiotic that's commonly used and is very safe, right? So if you don't take that drug, like to its completion, right, then we may have to end up giving you a stronger drug, which actually may be a little bit more risky for the baby. And that's what a lot of people don't think about. They're just trying to put the bare minimum into their bodies, and that's not always the best thing. So it's very important to me that you guys understand that you really need to take all of your medications as prescribed. Now, we had another one which kind of came with a scenario, so I'm going to go ahead and read that. And it said, I'm 17 weeks pregnant, and I was prescribed cephalexin 500 milligrams every 8 hours for 7 days because I went in with a pilonidal cyst. When they tried to drain it, nothing came out, so they assumed a skin infection because I was red and tender in that area. Would I be okay to take this antibiotic as I am pregnant? Is my baby safe because I am taking this? So this is a great question also. And so one of the reasons why, even though this person has a skin infection, they're trying to treat it is, again, any infections, if left untreated, can become a big deal. I'll tell you guys, one of the reasons why I highlighted this question, and I thought it was really good, is that she has a cyst. So cysts can be very detrimental to you, right? And so when they try to drain those cysts, if they get any type of secretions, you need to ask them to send it to a lab to make sure you don't have MRSA. MRSA is methicillin-resistant Staphylococcus, I think. Staphylococcus aureus. Thank you. Staphylococcus aureus is the name of the bacteria. Methicillin is the name of an antibiotic. Resistant, it doesn't work well with that particular antibiotic or anything in that class. Basically, this is a very, very aggressive bacteria that's very hard to treat. So it's important to know if that's what's going on in some of these cysts, because that is definitely something that needs to be aggressively treated. So now cephalexin is safe for use during pregnancy. And again, even though it might be a skin infection, it's still very important to treat it aggressively. I've seen women who had ear infections that they didn't want to take anything, and they ended up sick and in the hospital because the ears are connected to the sinuses are connected to the throat is connected to the lungs. And before you know it, that little ear infection turned into pneumonia. Do not discount infections when you are pregnant. You are immunocompromised. This is why we also stress getting the flu vaccine and why we stress getting the COVID vaccine, because you are at high risk for severe illness or, unfortunately, even death when you're pregnant from these viruses. The last one came in on this video, but it's actually not really about antibiotics, but I love it. Is it safe to take lacto-gut tablets before trying to conceive? So lacto-gut was not something I was familiar with because it's not in my country. However, lacto-gut is basically a probiotic. So I love probiotics. So let's talk about probiotics. Probiotics are basically a pill that usually has a whole bunch of bacteria, good bacteria, that helps to balance out your gut so that your stomach and your intestines work properly. Bacteria is important because bacteria is actually something that we need. When your baby is born, your baby actually needs a vitamin K shot. And the reason why they need a vitamin K shot is vitamin K helps your blood to clot. So when you get a cut, the reason why it stops bleeding is because it clots. Those clotting factors need vitamin K to be made. Now, we get vitamin K from bacteria in our gut. But your baby is born with a sterile gut. There's no bacteria in there. They're going to get all of that bacteria from, the environment around them. So we give them that booster shot until that bacteria starts to colonize their gut and gets going. So that bacteria that lives in us, it serves a lot of different purposes, and it's very important for our health. In addition to that, your gut also has receptors for stuff like serotonin. Serotonin is one of the neurotransmitters that helps with depression and anxiety. So if your gut isn't doing well, you may not get that the right way. It helps to digest your food, digest your vitamins, everything you can imagine. Your gut is so important. So I love probiotics. However, probiotics are not regulated in this country. The FDA does not look at them. They do not look at the ingredients. They do not look at the manufacturing. They don't look at them at all. So when you're talking about a probiotic, there is no studies, no data, no quality control to know whether that is safe or not. And just so you guys know, probiotics that are given to babies, which I also love, are not FDA monitored or controlled. It's still a vitamin. It's still a supplement. It doesn't matter that it's being given to a small baby. It is not monitored. And a lot of people don't realize that. They just assume that it's all good. When it comes to probiotics and stuff like that, and if it's not studied, you have to be really careful with this. You don't want to talk with your healthcare provider who knows your individual health history and health makeup to see whether that would be a good option for you. I can tell you when I talk to a lot of my pregnant moms and they need to use certain things, or they want to drink tea. Tea is another one, guys, that you should consider an herb, like an herbal supplement, and not like a drink. When my moms want to drink tea, I tell them to drink good old Lipton, because Lipton is being bought by thousands of people all the time. If it was dangerous or killing people, we would know it. But some of those offshoot, organic, only a couple people buy it, you don't know because there's not enough data out there for that. So if your doctor does approve a probiotic and they don't have a particular probiotic in mind, you probably want to pick one of the ones that you see all over the place, because those are most likely the safest out of all of them, because tons of people are taking them and nobody's having issues. So unfortunately, is it good to take before conceiving? Yeah, I would say everybody should take a probiotic. But if you were to get pregnant on it, should you take it? Not sure. It's not really studied well. Um, Hi, Burn. So, what are some of the postpartum issues that should be reported as abnormal? This is a great question. So, I actually have a video on this. And so, I would urge people to check it out because it also gives a few more details. What I will tell you is some of the most common ones are hemorrhage. That postpartum hemorrhage is a big deal. So if you start bleeding a lot, and what is a lot? If you're soaking through a pad in an hour or less, that's too much bleeding. You need to call the doctor. If your bleeding is getting lighter, 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 and then all of a sudden it gets a lot and dark again, you need to call the doctor. Those are two big signs. If you start passing clots, so it's very common after you give birth to pass clots. And usually they'll say anything smaller than a quarter, you should be fine. Don't worry about it. I usually tell people if it's a dime or smaller, you should be good. Otherwise, call your doctor. But there are some times where people will pass clots so big they look like a placenta. But the bottom line is, if it's anything bigger than a quarter, like say a golf ball size or bigger, you need to call your doctor. That could be a sign of hemorrhage. Next, headache. If you get a headache that will not let up, even if you take like Tylenol or something, you need to contact your doctor immediately. A headache is most likely a sign of preeclampsia, which we have a video on. Preeclampsia, what a lot of people think of, and I think part of it's because it says pre, and preeclampsia is about, it's right before eclampsia. Eclampsia is when you actually start having seizures. But I think a lot of people hear pre and they assume it's before you have the baby. Preeclampsia can occur well after you have the baby, like 6 to 8 weeks after. And so you can have it, and it's represented by changes in your vision, a headache, or right upper quadrant pain. So it's very important that you recognize those signs. That is considered a medical emergency. And in fact, in the South Florida area, it's such a big deal that all of the hospitals around here, all of them, every hospital gives a woman a blue rubber bracelet. And that blue rubber bracelet says preeclampsia, and they tell the moms to wear that 24/7 until 8 weeks after birth. And that band, if they were to ever get into a car accident or something was to happen to them, any hospital in our 3 counties can look at that band and know exactly what just happened. They just had a baby and they've had preeclampsia, or they're at risk for preeclampsia. And that helps to guide their care. Now, part of preeclampsia is high blood pressure. And a lot of people are like, well, just treat them with blood pressure meds. But a woman who has preeclampsia, her blood pressure and her treatment plan is radically different than the woman walking down the street with high blood pressure. They're treated very differently. And one of the best examples is magnesium. We give magnesium IV for a lot of different reasons in the hospital. So on the regular floors, the most magnesium they'll give is like 1 gram. In labor and delivery, we'll give 4 grams. So that is considered an overdose anywhere else in the hospital except labor and delivery, because it's specific to preeclampsia. So this is why it's important that people know. Next is if you get a redness and swelling in one of your legs, especially if it's also warm to the touch, that is possibly a blood clot, which is also considered a big emergency. Any trouble breathing, which could also be a sign of a clot. And then, oh my gosh, if you have any drooping or numbness on one side of your face, we worry about stroke, but more likely it's Bell's palsy, which can also happen after birth. And the final one is actually depression and anxiety. There is a lot of evidence that depression may be the number one complication after birth, and it is a very big deal, and it needs to be treated right away. And if it's treated early, you can actually have a lower incidence of a long-term postpartum depression. So I hope that helped. Please feel free to put any other questions into the chat, or if you guys have, any elaboration on your questions. So I I had a question on my birth control video. I have a birth control video, which I think is very important because birth control is a big deal. You have to figure that out afterwards. And it said, what is the safest method to use after having unprotected sex after 1 month of giving birth? Okay, so this question was a little confusing, but it's a great question. Okay, so if you do not want to have a baby, you need to use birth control. Birth control. Okay, 100%. You have to use it. The pull-out method, which is where a man does not have an orgasm inside a woman and instead does that outside of the body, is not an effective form of birth control. It does not work. I have women every single month come to my practice who got pregnant using that method. The reason why it's not effective is that men start to leak semen well before they'll have an orgasm. So some of the fluid that is coming out of their penis during sex is actually, it has semen in it. So you can get pregnant off of that. So that is not effective. Now, some people will say they're in a committed relationship. Their partner is always going to use the pull-out method. They're never going to use a condom. They can't use like hormonal birth control. So actually, one of the options that can help with the pull-out method is the diaphragm. It's old school, and a lot of people don't talk about it anymore, but it's still around. So the diaphragm is basically just like a rubber cap. So it goes, your cervix is like this, and it goes kind of on top of the cervix. It's just rubber. That's it. It has no hormones, nothing else, right? So I think the diaphragm, please don't quote me 100%, but I think its effectiveness is 60%. And then you can add spermicide. Spermicide is a chemical that actually kills sperm. You can add spermicide to it, and I think that brings it up to like 80%. So if you're using a diaphragm with spermicide and your partner's pulling out, that's probably the safest way for you to prevent pregnancy without hormones and without condoms. Of course, there's condoms, and then there's a wide variety of birth control options, IUDs, pills, there's a insert, there's rings that you can put around the cervix, all sorts of stuff, okay? The biggest thing you need to understand is you need to take your birth control as it's prescribed. It's very possible that you are very sensitive to your birth control, which means if you even take it like late by 2 hours, then you are possible to get pregnant. That is a thing. The other thing is a lot of medications interfere with your birth control. For example, antibiotics oftentimes make birth control ineffective. A lot of the mood stabilizers make birth control ineffective. And then if you have like diarrhea, you should consider yourself not being protected, that your birth control is not working, and you should use an alternative backup. And a lot of people don't realize that, but that is actually the case. So it's very important to understand that. But is there a safe way to have unprotected sex and like avoid pregnancy? The answer is no. I mean, ultimately, you have to use some kind of protection or birth control to avoid it if possible. Sales promoter, can one's diet be harmful to pregnancy, possibly leading to a miscarriage? So that's a very good question. So generally speaking, your diet is not going to be a factor. There's, of course, we could talk about the fact if you look at all the foods that are to be avoided during pregnancy, like raw fish or fish that has a lot of mercury in it, it is possible that those things might not be as healthy, but really there's no evidence to say that. Really the best thing is for you to have a well-rounded diet, with the exception of folic acid. So folic acid is very much talked about all over the place. Folic acid is necessary for the formation of the brain and the spinal column. And if you don't have enough folic acid, it puts you at risk for a baby that might have spina bifida or other things. What we are starting to learn is that miscarriage is a lot more common than we realized. It may be as many as 1 in 5 women will experience at least one miscarriage. What a lot of people don't realize is many women will have a miscarriage without ever knowing that they were pregnant. They will actually become pregnant and they will miscarry without even knowing, and they just feel like it's their normal period. They never knew. Your body is designed to protect you. And so early on, very, very early on, if there are any abnormalities that your body senses that may not be compatible with life, your body will try to have a miscarriage in order to prevent you from having a pregnancy that might be harmful to you. And the sales promoter, I hope that you understand I'm trying to say this with the utmost sensitivity, because I know this is probably a very sensitive subject for you. One of the major causes of that potential is like spinal cord abnormalities, because those aren't compatible with life usually. And those are usually caused by folic acid deficiencies. Now, one of the things that I will tell you, the sales promoter, is it's important to understand if you are like absorbing your folic acid right. And more importantly, if you have something called MTHFR. So MTHFR is a genetic mutation. Sounds really scary, guys, but MTHFR is actually not as bad as it sounds because it's really easy to treat. But basically, and I'm going to give you the broadest sense of this, MTHFR is a genetic mutation that means that you can't process folic acid like everybody else does. And so if you don't know this and you don't know your status, this could actually lead you to have miscarriages. So here's how you look at it. Imagine if folic acid is soft serve ice cream, and regular folic acid that you get in a vitamin is the soft serve ice cream with a chocolate shell over it. Okay. So anybody who does not have MTHFR, who can process it normally, they can get through the chocolate shell and they can get to the soft serve ice cream, which is your folic acid. So they can go right through that barrier and get what they need. But somebody with MTHFR, they can't get through the chocolate shell, or they get just a tiny little hole. So they're only getting tiny bits of that folic acid. So they really can't access it the way somebody who can metabolize it normally does. So what does a person with MTHFR do? They take L-methylfolate. So L-methylfolate, imagine, is folic acid, your soft serve ice cream, without the chocolate shell. So you can immediately access it. Now, the evidence is showing that if you have the MTHFR genetic mutation, they still want you to take regular folic acid along with the L-methylfolate. It is recommended to do both. That there's a couple different variants of MTHFR. It gets a little bit muddy water from there, but that's your basic overview. And again, it's not really scary because it's so easy to manage. It's just another vitamin. That's it. So that is the one thing that I'll tell you from a diet perspective could be an issue. The only other thing I'll tell you is you need to have enough calories. Women who have a history of anorexia and are very calorie restrictive will oftentimes have some issues as well. Burn, is it possible to elaborate a little bit more about postpartum bleeding? Does the color matter? Bright red, dark red? Good question. So I have a video on colors of blood, which should apply because the colors kind of do the same thing. So pink is basically some kind of secretion with red blood. Then you have bright red, dark red, and brown. Brown is resolving blood. So that dark red is kind of that transition from bright red to brown, okay? Bright red is active bleeding. That's what we consider to be active bleeding. Now, as far as when you're talking about postpartum, it doesn't matter bright red, dark red. What matters more is, okay, well, it does matter. It matters if you go from bright red to say brown or pink, like it's basically resolving, and then you go back to bright red. And when I say back to bright red, understand this is a lot of red, okay? You don't have to be gushing blood, but bright red with a significant amount on a pad is something that you want to take a look at. So that is something that you need to be kind of cognizant of. Usually the two things is a change in color going backwards or a change in amount, meaning the first couple of days, like the first day you have a baby, you bleed the most. And the second and third day, it's like a super heavy period. It may be more than a heavy period for you. But after like day 3, it should start to taper off. Now, it can take up to 6 weeks, but it should start to taper off. So if you're having bleeding that's really going for a long time and it's really not letting up or gets worse again, that's a thing. The actual other thing I'll tell you about bleeding postpartum, which a lot of people don't realize, if you are bleeding heavily, okay, not heavy enough to go back to the hospital, but heavily, you're going through 3 or 4 pads a day at least, that kind of thing, and you're about a week or more postpartum and your milk has not come in, your breast milk has not come in, you don't seem to have a good supply no matter what you're doing, you're pumping and everything, that is most likely a sign that you have a piece of retained placenta. So the placenta embeds itself into the uterine wall. And when you deliver, it comes off. You deliver that. And at the point that that delivers, it sends some like hormonal chemical signals to your body to say, hey, buddy, I'm not pregnant anymore. And then it starts a whole bunch of other processes, including the process of making breast milk. So if a little tiny piece of that placenta stays in the wall, that hormonal signal actually never happens. So your body doesn't understand that you're not still pregnant, which is why you don't start making breast milk. In the meantime, after delivery, one of the reasons why we give you oxytocin is we need your uterus to kind of contract back down to its normal size. And when it's contracting, this whole area, if this was where your placenta was, this whole area is going to be open blood vessels. And when it contracts, it's so that we can get it to clot off. Otherwise, you'd be bleeding too much, otherwise known as a hemorrhage. If you have a tiny piece of placenta here, most of these will be able to clamp down, but not all of them, which is why you'll have excessive bleeding that lasts a lot longer than we expect it to. The treatment for this, if you have this, is a DNC. That's dilation and curettage. You basically have to go back to the hospital. They'll give you anesthesia. They dilate your cervix and they scrape out the walls of the uterus because they have to get that piece of placenta out. So I hope that helps. And that's a good question. I have a question on my bleeding video. I'm 2 months pregnant. Last month I experienced bleeding for 2 days, and today I noticed spotting again. Is it safe? I'm worried. So bleeding, as we can see, is a very, very important topic for a lot of people, both when you're pregnant and postpartum, because bleeding can really lead to a lot of serious complications. There are a lot of different reasons why bleeding can happen that is normal. Bleeding during the first trimester is the one that we kind of, obviously we do need to pay attention to it. It's very important to get it checked out. You do need to go to your healthcare provider, but there's a lot of reasons during the first trimester why you may spot or bleed. You may be having a regular menstrual cycle. You can actually have your period and be pregnant. Sometimes your body just doesn't understand what's going on. It could be from sex. The tissue of the vagina gets very dry. And so you can have like little micro tears that happen, and that could be the cause of it. You could have a subchorionic hemorrhage, which